Just as beautiful flowers and plants can adapt and grow under the most difficult conditions, older adults with dementia find special ways to adapt and can even thrive in an appropriate setting with realistic expectations. The term dementia, which literally means loss of mind, represents the brain deterioration characteristic of a variety of dementing illness processes. This deterioration has a slow, gradual onset, which usually includes deficits in mental functioning, problems with thinking, memory, and reason, significant impairment of daily functioning. Some dementing illnesses are reversible, but most are either non-reversible or progressive in nature. This program focuses on the middle stages of Alzheimer's disease, the most common type of progressive dementia. Many of the characteristics in the varying stages of Alzheimer's disease are present in other types of dementing illness processes. So many of these communication techniques may be applied to other forms of dementia disorders as well. Dr. Barry Riesberg and his colleagues defined 7 stages in the progression of Alzheimer's disease known as the Global Deterioration Scale for Assessment of Primary Dementia. During the early 3 stages, most individuals with Alzheimer's disease and those around them are unaware that this insidious dementing illness process has begun. It is very important to realize that individuals with Alzheimer's disease may vary in these stages from day to day. Assessment of the stage of cognitive decline and related approaches needs to be done on an individual basis and interpreted with great flexibility.
Who are these people?
My mother and father.
That's your mother and father.
Mm-hmm.
I'm glad you have that picture.
My father had a bookstore here,
Oh, he had a bookstore.
Uh-huh.
And did you help him with that bookstore? Or?
He used to let me sell birthday cards and things in there.
I see. And I think that we have some pictures of that store, which we'll be looking at.
Right in one of
Is
my
it in
drawers.
which drawer is that picture in?
It's in that.
Oh, there are those beautiful pictures. Now this is the store that your father had.
That was the 223 West Spear Street, right next to a restaurant. Gassers is there.
Oh, sure, right next to Gassler's
It wasn't
restaurant.
right next to it, but it wasn't very far away. It was in the same block.
And I see this picture was taken in 1896.
Yeah.
Mm-hmm. What do you remember?
Well, see, I wasn't born in 1886.
You weren't born in 1896.
No.
Did the store look like this when you were little?
Oh, it was that way for many years.
By stage 4 of the Riesberg scale, a number of characteristics become evident. Memory deficits regarding personal past, recent, and current events, concentration deficits, difficulty with travel to unfamiliar places, handling finances, or similar responsibilities. Most of the time, individuals in this stage are oriented to time and person, can recognize familiar people, can travel to familiar places, and engage in familiar tasks. Denial of problems, defensiveness, and withdrawal from challenging situations is common at stage 4.
Very often at this stage 4, you see a lot of fearfulness, a lot of frustration. They're very time-consuming. They're looking for someone to spend time with them, needing reassurance. Also, as we've said before, supervision becomes an issue where they know possibly that they are in a locked unit or that they can't stay home alone, but yet they need someone to be going with them because they cannot find their way back. And so they need that supervision, but yet they are aware that someone is with them and needing assistance, and you need to have that quality of patience and the respect for them that goes along with caregiving.
Typically, it's clients who are in stage 4 that come into contact with social workers or other people that feel that they can't make the decisions necessary to see that their needs are met any longer. So those are the clients that come my way as a guardian. Typically, those are the clients that aren't making it. They don't have a family who's providing some kind of support to them. But on the other hand, they're able to kind of bluff their way through sometimes and convince people that don't see them very often that they are making it, which becomes a problem when we go for a court hearing. If the judge wants to talk to the client and they're having a good day, sometimes it's difficult to prove in a court hearing that the client does need a guardian because they are having a good day. But then that's where you need the testimony of those people who have been in close contact on more than just an infrequent basis to prove that the client really isn't making it in that situation any longer and they need some help.
As the daughter of someone in stage 4, I find this extremely difficult period in that the person is not aware of how much help they need, and yet they may not accept help when offered, and it puts the daughter or child caregiver in a great deal of in a dilemma that is almost impossible to solve. With respect to my parent who was in this stage, I tried very hard to get them into a setting where they would get more supervision, and they refused that. And one of the comments was, "It's my life, it's going to be my death," and I had to just accept that.
In stage 4 in the hospital, often you'll see these people come in and the families are wanting something done. And I think back over different cases where, for example, the medication Cognex, which is on the market, and often families are hoping and expecting and wanting to believe that this is going to solve the problem. And I just wanted to point out the tremendous amount of support and education that families need at this point, you know, that this may not be as effective as they're hoping, and that starting at that point to plan for how they can help manage this individual over time.
I think it's stage 4, people are very frustrated. They remember something but can't remember how to express themselves. They have feelings, they can't get it across. So it's up to the individual, the caregiver, to help them along with, well, say if someone is at the door and she wants to get out but she can't, and just tell her, well, do we have a cup of coffee up the other end, or go to the dining room, or let's go read a book, or let's just take a short walk. But I think they're very frustrated.
It may be important to simplify the conversations that you have at this stage by asking closed-ended questions, questions that can be answered by yes or no, questions that are posed that require a great deal of cognitive process, often increase the confusion and the frustration.
I think at this stage there's so much self-doubt that reinforcement becomes terribly important, and when they do something well, or when they socially interact appropriately, it's terribly important to point it out to them, maybe with a touch. The self-centeredness is the way we feel about many of them as we see their abilities to interact deteriorating. But I think that does relate to the anxiety, the fearfulness that's been mentioned. And again, I think they give us many opportunities to stroke and to distract,
When communicating with stage 4 individuals, it is important to maximize use of gracious, polite social interaction. Realize that these individuals may be using their lifelong defense mechanisms in extreme forms, such as denial, blaming others, and hoarding. Work with these defenses rather than against them in order to help these individuals feel increased levels of self-competence and security. Avoid situations that make their mental deficits apparent and are too challenging for these individuals.
Wow, you are beautiful, inside and out. You know that? Oh. Are you happy to see me? Sure. Well, I'm so happy to see you too. It hasn't been that long, has it? No. No, I see you as much as I can, don't I? Yeah. Who did your fingernails? They're beautiful. They look so nice. I can't even read. Did you have a good night's sleep?
Yes.
Did you?
Very good.
Good, good. Oh. I don't want to make you cry. You're feeling fine?
Yeah.
Going to have breakfast soon?
Yes.
Yes. What's your favorite breakfast food? You like pancakes? Eggs? Yeah. You have good food, don't you? Good. So you feeling okay? Yeah. Maybe we'll go for a walk later. Such a nice day out there. Would you like to do that? I would too. I'd like to take you for a walk. Maybe after breakfast we might be able to do that, okay? I'd sure like to. Well, you are such a sweetie.
Betty is at stage 5 of the global deterioration scale. At stage 5, individuals can no longer survive without some assistance, forget some major relevant events in their daily lives, are usually oriented to person and usually remember the names of those they've known for a long time, are frequently disoriented to time and place, require little or no assistance with eating or toileting, may have some problems with choosing appropriate clothing.
And although Betty doesn't really know who I am per se, she knows that I have a significant importance in her life. And that's why she responded to me. The way I came in, hi, how are you doing? And very positive, very accepting. Betty was able to get into that role and feel very comfortable with my approach.
You need to use a smile, you need to use touch, warmth, not be threatening. Just open up your arms and they pick up on that right away.
The changes I have seen with Betty over the past year have been instrumental in her communication skills. I think that her verbalization has become greatly reduced. She's not able to communicate her needs. She searches for nouns and at times is not able to correctly indicate what it is that she needs. So a lot of times staff needs to anticipate what she needs by watching what she's doing and with the message that she's trying to convey.
Betty has trouble now as far as dressing, more problems with dressing. She needs more help in trying to find out what her needs are. She knows she needs something, but she doesn't know what she needs. So you need to try to figure that out.
Alice is also at stage 5, but further along in the dementing illness process.
I have a twin sister.
You do? What's your twin sister's name?
Esther.
Esther? She's a little bit smaller than you. She's a good egg.
Where is she? I haven't seen her for quite a while.
Well, you know, I haven't seen her this morning either.
Oh, but she is around here.
Yeah, you know how she is. She comes and goes.
Well, I don't know because I haven't been seeing her.
Yeah.
I've been away from here.
Yeah. Well, now that you're back, she'll stop by.
Where is she? It wouldn't be you.
She always does.
Come on now. I was born there a few years ago.
Where were you born?
Ladysmith,
Ladysmith.
Wisconsin.
Oh, I'm from Wisconsin also.
Oh, are you?
Mm-hmm. A little north of Ladysmith.
Oh.
Between Ladysmith and here.
Oh. Oh, sure. Yeah, my name was, oh, I can't think. But my husband was pretty well known around. Not my husband, but my dad. But I was just a little.
Now, did you live in Ladysmith a lot of your life?
Well, no, until I was grown up. And then we came up to Duluth.
I see.
My parents did.
So your growing up years, you were in Ladysmith.
Yeah.
And what did you and your twin sister do?
We didn't do anything. We were too small.
Well, I bet you went to school.
Oh, yeah, for a few years. Esther and Alice.
Esther and Alice, both twins.
Yeah.
And you're Alice.
Yeah.
Did you ever go, I don't know, in the winter, did you go sliding?
Oh, sure.
Play in the
Ladysmith?
snow?
Yeah. Oh, sure.
And did you ever go to any dances when you were getting a little older?
Yes. Yeah. We tried at least.
You tried? Did some boys ask you to dance?
Oh,
I bet.
of course.
Of course.
They still do. Alice's stages seem to vary with the minute. It appears sometimes she understands a little bit more than other times. Her moods can switch very quickly from minute to minute. Sometimes she's definitely more alert than other times and appears to understand more what you're saying. Alice's repetitive themes normally include her twin sister who's been gone for about 70 years. It also includes her husband who's been gone for years, and her other brothers and sisters.
Stage 5 often is the stage in which families will consult an ombudsman for choices in long-term care placement. It's extremely difficult for families at this point for two reasons that I hear. First of all, the person with dementia no longer recognizes members in the family. This is extremely difficult for a spouse and even for children. And first of all, it's difficult, and then it becomes very annoying. There's a sort of a double-edged sword here. I'm hurt, he doesn't remember me, and why is this happening to my father? The next issue is the dependence, the total dependence at this point. And it is what an ombudsman sees is that a family does start seeking outside help because the care requirements become so heavy.
This is a stage where people are totally dependent on their environment. This is a stage where people basically have little or no concentration skills, and thus what happens in their environment they cannot understand. So it's quite important that the environment be stable, be safe, be simple, and be something that the person can respond in a favorable manner to.
That's where special programming becomes very important in different situations, where you need to break down those tasks. You need to break down that activity to where someone can't comprehend to do 5 steps. They need 1 or 2 simple steps, whether it's through a visual cue or an actual physical assistance. And that's where it becomes where the person needs to feel useful to do a task, a simple task, and yet makes them feel very respected and that they still can do something. And that goes back to where a balloon toss or simple activities where we think it's simple, it's actually where they're feeling that they are able to do that because they can no longer do certain things that they did in their past.
I think during that stage you need a lot of compassion and a lot of imagination, especially if you're trying to get him into clothes or into the bathtub. It's sometimes very hard to tell him, let's go take a bath, especially if it's a man.
One of the things that happens at stage 5, it seems especially that I notice, is the wandering. This is a stage where the person starts to become wandering and in a dangerous manner. They become agitated where they are and they want to get out. And often this wandering can be quite unexpected. It can happen suddenly. The person gets the urge, I want to go, and they go. It's maybe in the morning, maybe in the afternoon, and especially it can happen in the middle of the night. Because often they start waking up at this stage at night. Their rhythm starts becoming, at some evenings, their rhythm of day and night starts becoming confused. And they start waking up in the middle of the night, and they may just decide, I'm going to exit, I'm going to leave. So one always has to be careful in dealing with individuals at this stage because of that.
I always try to think that myself that it's better to not focus on the change of the behavior, particularly the problematic behavior of the confused person. We had better focused on the change of our attitude to the elderly person. So without changing our attitude to the elderly person, their quality of life wouldn't be good enough.
When working with stage 5 individuals, it is important to join their world and allow their behavior and confusion to help you identify the needs they can no longer verbalize. Learn and communicate to others ways to help these individuals connect with memories that help them feel competent and secure. Provide verbal and visual cues in order to promote as much orientation to significant people in their lives and the immediate environment. Continue to be gracious and polite in order to make maximum use of social skills to minimize defensiveness as more assistance is needed.